Should people wear face masks and do face masks work at all? According to this lady, face masks actually don't work that much. They don't protect us from the virus because the virus is not floating out there in the air.
So it's not protecting me against anything because it's not there.
But interestingly, later in the same video, she did say that the virus could transmit from person to person not only through us touching our faces, but also through us inhaling droplets directly from other people sneezing or coughing around us.
If we're inhaling droplets directly from someone who is sneezing or coughing.
So the answer to our question whether face masks work should be yes, because face masks could prevent us from inhaling droplets around us. So unlike what the lady suggested, face masks do work. Then should we wear them? WHO has said we should only wear a mask if you are sneezing or coughing, or if we are taking care of a person with suspected COVID-19 infection. But the problem is, people with no symptoms at all could be virus carriers. Could be due to the incubation period, or could be just because they've got really good immune system. So we simply couldn't say for sure whether we ourselves or anyone we are in contact with carry the virus or not. Well, at the first sight, it might seem just alright as long as we all practice social distancing and cover our noses and mouth when we sneeze or cough, just as we were told. Except it's not alright. We've been practicing social distancing for a while, and people are taking it more and more seriously now, which is good. But there still might be some cases in which we simply couldn't practice social distancing that well. For example, I was watching news over lunch the other day when the BBC presenter made a very good point by asking the question, am I safe if I run past another runner within the 2-meter distance? Well, really, it could happen to anyone. You are running on the footpath towards this direction, and there's another person running towards that direction. There's a corner here. You wouldn't be able to practice social distancing until you see each other, which is most likely the moment you approach the corner. And it might already be too late for you to practice social distancing properly because you are already within the 2-meter distance from each other. Another example is shopping at the supermarket. It could be the case that you are shopping along this aisle and someone else is shopping along the next aisle. You both want to move on to each other's aisle without knowing each other's existence. You would only be able to practice social distancing when you see each other, but it was already within the 2-meter gap, I'm afraid. Not to mention, droplets are not only available when we sneeze or cough, but also available when we talk, when we laugh, when we get emotional, and even when we breathe after running or workout. And it could take up to 3 meters for droplets to land.
More importantly, although at a preliminary stage, some research has recently suggested that this new coronavirus could remain airborne for up to 3 hours.
As we all know from the news, currently in the UK, apart from the vulnerable, only people showing symptoms and those in contact with them are asked to be self-isolated, and only people showing symptoms will be offered a test. But people could have the virus before or even without showing any symptom. Then when we encounter people at the supermarket, however brief it is, there is a chance to meet a virus carrier, therefore a possibility for the virus to spread. In fact, there were such cases in China previously. There was one man with a super good immune system. He was a virus carrier, but tested negative initially and showed no symptom afterwards. So he went shopping without knowing he's got the virus and got quite a few people infected. Really, it could happen in other countries, including the UK as well. It could be someone shopping along the next aisle. It could be one of us. In face of the Covid-19, we just can't take any risks. I definitely agree that people working at the NHS are the people who need PPEs, including face masks, the most. But other key workers, including cashiers at grocery stores, also need them because of their working environment, because they are in contact with many of us every day. If by any chance any one of us, the customers, were a virus carrier, they could get the disease when we get our daily necessities. As for non-key workers like me, we should also wear face masks as a form of protection for ourselves and others. As I said, when it comes to face masks and other PPEs, we should always give priority to people most in need, including key workers and people in the at-risk group. We don't want to panic by face mask, but we could offer our own protection by making our own face masks and wearing them when we go grocery shopping.